psychological disorders. Over the years, more illnesses have been added to the list of traditional psychophysiological disorders, many links to stress and psychoneuroimmunology. Psychoneuroimmunology is the study of connections between stress, the body's immune system, and illness. The immune system is the body's network of activities and cells that identify and destroy antigens and cancer cells. Among the most important cells in this system are billions of lymphocytes. The three main types are helper T cells, natural killer T cells, and B cells. Helper T cells identify antigens and then multiplies and triggers the production of other kinds of immune cells. Natural killer T cells seeks out and destroys body cells that have already been infected by a virus, helping stop the spread. B cells produce antibodies and mark them for destruction and prevent them from causing infection. Stress can interfere with the activity of these lymphocytes, slowing them down and increasing an individual's susceptibility to viral and bacterial infections. Are physical illnesses related to stress? In 1967, Holmes and Ray did the Social Adjustment Rating Scale, which assigns numerical values to the stressors and that most people experience at some point in their life. These are ranked by LCUs and ranked from 0 to 100. Scale gave researchers a yardstick for measuring the total amount of stress a person faces over time. The setbacks with this is that certain races differ from each other, certain ages differ from each other, and even certain genders differ from each other when ranking the most stressful things in their life. Several factors that influence stress in the immune system. Biochemical activity. Excessive activity of the neurotransmitter norepinephrine contribute to slowdowns of the immune system. Stress leads to increased activity by the sympathetic nervous system, including an increase in the release of norepinephrine through the body and brain. If stress continues for a long time, norepinephrine eventually travels to the receptors on certain lymphocytes and gives them the inhibitory message to stop activity. Corticosteroids, also known as cortisol, and other stress hormones contribute to poor immune system functioning. When a person is under stress, the adrenal glands release corticosteroids. Another action of corticosteroids is to trigger an increase of the production of cytokines. As stress continues, more and more corticosteroids are released. The growing production and spread of cytokines leads to chronic inflammation, heart disease, and stroke. Personality style, behavioral changes, and social support. People who generally respond to life with optimism, constructive coping, and resilience experience better immune system functioning and are better prepared to fight off illnesses. People with hardy or resilient personalities remain healthy after stressful events, while those whose personalities are less hardy seem to be more susceptible to illness. Stress may set in motion a series of behavioral changes that indirectly affect the immune system. People under stress become anxious or depressed and even sometimes develop an anxiety or mood disorder. This resulting in poor sleeping, eating, exercise loss, and an increase in smoking or drinking. People who have fewer social supports feel lonely, seem to display poor immune functioning, in fact, in the face of stress than people who don't feel lonely. Social support and affiliation may actually help protect people from stress, poor immune system functioning, subsequent illness, or help speed up recovery from an illness or surgery. Psychological treatments for physical disorders. Stress and related psychological and sociocultural factors may contribute to physical disorders, applying psychological treatments to more and more medical conditions. This field of treatment that continues psychological and physical approaches to treat or prevent medical problems is known as behavioral medicine. The first behavioral medicine I want to talk about is meditation and mindfulness. Meditation and mindfulness have recently been proved to help relieve physical and mental distress. People report feeling more peaceful, engaged, and creative. And it helps manage blood pressure, heart problems, asthma, skin disorders, diabetes, insomnia, and viral infections. So now I'm going to have you pause the video and click on the link and do a quick 5-minute mindfulness experiment to help relax you and let go of some of the stress you're currently dealing with. Great. Now that you're back, this experiment was supposed to help calm the mind and any stressors that you might be dealing with. Constant stress has long-term psychophysiological effects and physical effects. So maybe working in meditation and mindfulness into your day for a quick 5 minutes will have better effects in the long term. Real, Relaxation treatments, hypnosis, and cognitive interventions are a few other types of behavioral medicine. People can be taught to relax their muscles at will, a process that sometimes reduces feelings of anxiety. Relaxation training can help prevent or treat medical illnesses that are related to stress. Used with medication, it can help treating insomnia, asthma, diabetes, pain after surgery, certain vascular diseases, and certain cancer treatments. Hypnosis is now used as an aid to psychotherapy and to help treat many physical conditions, helpful in the control of pain. There was a case study used where a patient receiving dental surgery and was under hypnosis, and the patient claimed to be more relaxed. People with physical alignments have sometimes been taught new attitudes or cognitive response towards their alignments as part of treatment. An approach called self-instruction training has helped patients cope with severe pain. Switching negative thoughts to more positive thoughts have benefited them in their recovery process. Biofeedback support groups and combination approaches. Patients given biofeedback training are connected to machinery that gives them continuous readings about their involuntary body activities. Information from this feedback gradually helps gain control over these activities and helps in the treatment of anxiety disorders and physical disorders. Electromyography, also known as EMG feedback, was used to treat 16 people in a study who were experiencing facial pain. The changes in pitch, volume, and tone indicated changes in muscle tension. EMG feedback helped patients learn to relax their jaw muscles. EMG feedback has also been used successfully in the treatment of headaches, muscular disabilities caused by strokes or accidents. If anxiety, depression, and anger contribute to a person's physical illness, interventions to reduce these negative emotions should help reduce the illnesses. Researchers suggest that discussing or writing down thoughts of past and present emotions have improved a person's health and psychological functioning. Various psychological interventions for physical problems tend to be equal in effectiveness. Relaxation and biofeedback are equally helpful in the treatment of high blood pressure, headaches, and insomnia. That is the end of my presentation. Thank you so much for watching, and I can't wait to read your responses.